Welcome to Part 2 of Mental Health in Life and Sport for SMD 210. As we continue on in this lecture series, now we will learn about various mental health disorders. This second section including mood disorders and suicide. The American Psychiatric Association has a handbook known as the Diagnostic and Statistical Manual of Mental Disorders, currently in its 5th edition. And this handbook is used by healthcare professionals in the United States and much of the world as the authoritative guide for the diagnosis of mental disorders. Essentially, it is used as the main guidelines for diagnosing mental health disorders. The DSM-5 lists nearly 300 recognized mental health disorders. However, today we will focus on learning about the most common mental health disorders in the United States and for student athletes. The main mental health disorders that are categorized in the DSM-5 include mood disorders, anxiety disorders, adjustment disorders, personality disorders, neurodevelopmental disorders, among many, many others. Again, for this lecture series, we're going to focus on mood disorders. However, first let's focus on how we can recognize mental health issues and disorders in individuals such as our friends, family, acquaintances, as well as student athletes that you may work with in the future. In order to assess mental health status, one must do so within a safe, healthy, non-judgmental context. Take note of appearance, basic grooming and hygiene, motor coordination, eye contact, speech and expressive language, interpersonal characteristics, behavioral and mood characteristics, as well as orientation and alertness. All of these factors may indicate some sort of mental health issue or struggle that an individual is going through. So let's start with mood disorders. Mood disorders are characterized by gross deviations in mood or overall attitude and feeling. Typically, these are categorized by depressive disorders, bipolar disorders, and manic disorders. Depressive disorders. These are described, or it's important to describe these as not just being quote-unquote down in the dumps or having a bad day. Depressive disorders are clinical diseases or illnesses in which they affect an individual's mood, cognitive abilities or their thinking, as well as physical complaints. The American Psychiatric Association criterion based on the DSM-5 for diagnosing depressive disorders includes an individual experiencing issues for a 2-week period in which a depressed mood is accompanied by cognitive and physical difficulties. In addition, individuals with depression may display restlessness, mood that's more negative than usual, thoughts of death, suicide, or harming oneself, hopelessness, helplessness, clouded thinking or the inability to focus, feelings of guilt or worthlessness, loss of interest or pleasure in activities of daily living, lack of sleep and energy, changes in eating habits, sometimes eating more or very often eating less, feeling irritable or frustrated rather than sad. Major depressive disorder, or MDD, is a specific clinical diagnosis. Patients may experience 5 or more of the following symptoms during the same 2-week period. Depressed mood most of the day, anhedonia, or the inability to feel pleasure, weight loss or gain, insomnia or hypersomnia almost every day, psychomotor agitation or being irritable, fatigue or loss of interest, feelings of worthlessness, helplessness, or hopelessness, often feeling as though they're stuck in a deep hole, diminished ability to concentrate or make decisions, and possibly recurrent thoughts of death, suicidal ideation, and suicide attempts. In addition to these symptoms, an individual should represent a change from previous functioning. Their current mental status or symptoms are not how they previously were functioning. At least one of the symptoms must either be a depressed mood or loss of interest in things previously found enjoyable. Those two symptoms are key factors in diagnosing major depressive disorder. Again, take note that an individual experiencing depression won't just have specific negative thoughts or feelings such as being unhappy or that their life is not worth living. In addition, it will seriously affect their behaviors. So an individual may withdraw from people who they're normally close with, have trouble getting things done, or even getting up in the day. And it's also important to note that depression can cause physical symptoms as well, feeling sick and run down, having actual muscle pains and aches, weight loss, sometimes weight gain, and poor appetite. It is important to note that there are various differential diagnoses for major depressive disorder, or explanations why individuals might be experiencing those symptoms we previously discussed. Couple differential diagnoses include hypothyroidism, effects of a substance, so sometimes abusing a drug or negative effects of certain medications, mourning of a loved one or going through the grieving process. And major depressive disorder often occurs with another psychological disorder, and most commonly, depression occurs along with anxiety, but can also be seen with many different mental health issues, including eating disorders. So let's get the facts straight. There's not always just one single cause of depression, and in general, we're not exactly sure what causes depression in everyone. Depression does not progress the same way for everyone either. The outcomes may be drastically different. Depression can be brought on by certain events such as stress, loss of a loved one, hormonal changes, and they can be associated with illnesses and injuries. So, for example, an athlete having a career-ending injury may put them more at risk for experiencing depression. Depression can vary in intensity and duration from person to person, and it also can be hereditary. But remember, depression and other mental illnesses is not just a disorder that individuals can think their way out of or just hope it will go away. It does result in a chemical imbalance in the brain. It's not just in their head. And depression is a disease. Let's move on to mania. Mania is represented by abnormally elevated, expansive, or irritable mood. They're often described as manic episodes. So manic episodes may be experienced by too much energy, euphoria, exaggerating a job, extraordinarily restless, active, or requiring little to no sleep. And manic episodes can be very dangerous. An individual experiencing a manic episode should be referred to the hospital. Going through a manic episode, often an individual may engage in risk-taking behaviors because they may experience invincibility. What is the criteria that mental health providers use to diagnose a manic episode? This criteria includes 3 or more of the following observed over a period lasting at least 1 week with abnormally and persistently elevated, expansive, or irritable mood, an inflated self-esteem, decreased need for sleep, flight of ideas or racing thoughts, distractibility, excessive involvement in pleasurable activities that have high potential for painful consequences, or risk-taking behaviors, psychomotor agitation or feeling irritable, and pressured speech. So this leads us to bipolar disorders. Now that we understand depression and manic episodes, we will better be able to understand bipolar disorder. Bipolar disorder occurs when manic or hypomanic episodes alternate with major depressive episodes. Manic is extremely high episodes of mania, and hypomanic episodes are lower levels of manic episodes. Bipolar disorders create an experience of highs and lows, shifts in mood, energy, and severe mental distress. Often, individuals who struggle with bipolar disorders do poorly in school, have poor job performances, certainly poor athletic performances, relationship issues, legal problems, and very often suicide attempts. Now, these are individuals with bipolar disorder who are not in successful treatment. There are two types of bipolar disorders, type 1 and type 2. Type 1 is the most severe. So type 1 is when an individual experiences high manic episodes followed by very low major depressive episodes. Bipolar 2 is the less severe of the two disorders, in which an individual experiences hypomania episodes alternating with depression. The treatment for bipolar disorders includes medication, long-term prevention strategies, and counseling or psychotherapy. So let's get the facts. In some studies, 50% of patients with bipolar disorder have a history of a suicide attempt. Others report 80% of suicidal ideation and/or attempt. 1 in 5 persons with bipolar disorder complete suicide. This fact, again, is astounding. The risk of an individual experiencing bipolar disorder is very dangerous. As you can see to the right, this graph shows an example of bipolar 1 versus bipolar 2, in which bipolar 1, an individual experience high episodes of mania and very low episodes of severe depression, and where an individual with bipolar 2 will experience hypomania in conjunction with mild, sometimes to severe depression. Therefore, medication and treatment for individuals with bipolar disorder is crucial and essential to an individual's future and well-being in their life. Stopping medication as an individual with bipolar disorder can be extremely fatal because of the risk for suicide attempts. Relationship issues are often very stressed with individuals who are experiencing mental health issues, and in particular, mood disorders. Very often, individuals with depression, mania, and in particular, bipolar disorders have strained relationship issues between families, friends, and if we're talking about athletes, their teammates. Mood disorders causes a lack of motivation to participate in life, and therefore potentially to participate in sport as an athlete. Often, individuals with mood disorders lose interest in sexual intimacy, and this obviously can put a strain on significant other relationships. The overarching treatment for mood disorders includes referral, and that's really important because if someone isn't referred and isn't pointed in the right direction to the appropriate services, they may never get these subsequent treatments. The important treatments should always start with counseling therapy, and for some, lead to medication and sometimes prescribed exercise. When depression is treated, it often begins to subside within 2 to 3 weeks and may be fully alleviated within 2 months. But again, outcomes may vary seriously depending on severity and diagnosis. So someone experiencing acute depression may have a completely different outcome or experience with treatment than someone with major depressive disorder and certainly with bipolar disorder. Again, if treatment does not happen for an individual with mood disorders, or it's delayed, it can affect their outcome in their life as well as athletic performance. There may be an observed decline in performance that coaches, teammates, or athletic trainers can recognize, and this may be the point at which intervention or referral to a mental health care provider is offered. Sometimes this doesn't even occur, as we talked previously about the stigma of mental health in our society. However, if suspected, a patient should be immediately referred to a mental health care professional. Anyone experiencing depression or manic symptoms should be offered a referral at the very least. Those with mood disturbances and in particular changes in sleeping or eating should have an immediate referral. Whereas individuals who are having thoughts and or plans of suicide should be an emergency referral, in which an individual does not leave the side of the person struggling until they are brought to emergency attention, such as the emergency room. Depression medication is typically very responsive. There are various types of antidepressants. There are some side effects, as can be with many different medications, such as dry mouth, weight gain, changes in sleep patterns, headaches. However, depression medication is not habit-forming, and it does not change one's personality. And so therefore, it shouldn't be put off if an individual is seriously struggling after even going through psychotherapy. Understanding counseling or therapy or psychotherapy. Counseling may focus on stress management from prolonged stress that may have led to depression-type symptoms, symptom management, transition points in an individual's life, making the most of social support networks, and maintaining usual routines in life despite wanting to deviate. So this includes having individuals participate in social events, gatherings, maybe sport, etc., even if the depression is overwhelming and causing them to not want to engage in these activities and withdraw. Now let's shift and specifically talk about suicide. There are a few different ways to view suicidal thoughts. Number one is suicidal ideation. An individual experiencing suicidal ideation does not necessarily mean that they are making plans or seriously considering committing suicide. Suicidal ideation is significantly tied to mood disorders. An individual who starts to have thoughts about suicide typically is in such a bad place that they can't imagine going on with their life the way that they're feeling. Very often they're pigeonholed into a black hole in which the only way out and the only way to not feel the pain that they're feeling is to consider suicide. It's once an individual starts to continue on with their suicidal ideation and have exacerbated thoughts or creating plans of suicide that it becomes even more of an issue and an emergency. Here we will talk about suicidal ideation, thoughts, attempts, as well as suicide to completion. Let's get the facts about suicide. In 2013, there were over 40,000 suicides in the United States. That's 113 suicides per day, or one suicide every 13 minutes. In contrast, there's over 850,000 suicide attempts in the United States in 1 year. That's one attempt every 38 seconds. Males are more likely to commit suicide to completion, whereas females are more likely to attempt suicide. The means by which suicide occurs or is attempted is different between males and females, in which males, it's most commonly experienced by a gunshot wound, and females, most commonly by poisoning or mixing medications. More people die by suicide than by homicide in the United States. Suicide is the second leading cause of death in college students, behind accidents. And lastly, the number one cause of suicide in the United States is untreated depression. Looking at suicide in relation to student athletes, suicide is the third leading cause of death in collegiate athletes behind accidents and sudden cardiac death. However, it is arguably the most preventable of the three. One major myth that needs to be dispelled is that if I ask someone if he, she, or they are having thoughts about suicide, I will give them the idea to act on suicide. This could not be further from the truth. The fact is, the best way to confront suicidal ideation is to ask an individual in a straightforward manner, are you having or have you had thoughts about suicide? This is the best way to confront or potentially prevent suicide in an individual that you know has been struggling. The best way, however, is to refer them to a mental health provider. Now let's move on to the next video.